The Silent Epidemic: Understanding and Addressing Vitamin D Deficiency. Introduction. Vitamin D deficiency is one of the most underrecognized yet widespread health issues in the United States, affecting nearly 40% of the population. Often called the sunshine vitamin, vitamin D is essential for numerous bodily functions, including bone strength, immune defense, and mood regulation. Despite its importance, many people are unaware of their deficiency, as the symptoms can be subtle and easily mistaken for other conditions. In this article, we'll explore the signs of vitamin D deficiency, how to optimize your levels safely, and why maintaining an ideal range can be a powerful step toward preventing chronic disease and enhancing overall well-being. Understanding vitamin D and its role in the body. Vitamin D is a fat-soluble hormone that plays a central role in regulating calcium and phosphate levels, which are critical for healthy bones and teeth. Beyond musculoskeletal benefits, vitamin D supports immune health by helping white blood cells fight off pathogens, mood, and mental clarity through its influence on neurotransmitter balance. Inflammation reduction, a major factor in preventing chronic diseases. Cardiovascular health by improving endothelial function and reducing arterial stiffness. Hormonal regulation, including thyroid and insulin signaling pathways. Deficiency can impair these vital functions, leaving the body vulnerable to infection, inflammation, and long-term illness. Signs and symptoms of vitamin D deficiency. Many people are unaware they are deficient because the symptoms are subtle and nonspecific. Some of the most common early signs include persistent fatigue despite rest, muscle aches, weakness, or cramps, low mood, especially during winter months, increased susceptibility to colds and infections, hair thinning or brittle nails, delayed wound healing, bone pain, or frequent fractures. These signs can easily be overlooked or attributed to aging, stress, or poor sleep. However, they may be early indicators of an underlying deficiency that, if uncorrected, could increase the risk of osteoporosis, autoimmune diseases, metabolic syndrome, and even some forms of cancer. Optimal vitamin D levels, a higher standard for health. Most laboratory references define sufficiency as anything above 30 nanograms per milliliter, but integrative and preventive health experts recommend maintaining blood serum levels of 60 to 80 nanograms per milliliter for optimal protection against chronic illness. Regular blood testing, specifically 25-hydroxyvitamin D, 25 open parenthesis, OH close parenthesis D, is the most reliable way to measure your vitamin D status and determine whether lifestyle changes or supplementation are needed. How to boost vitamin D naturally. Sunlight exposure. The body produces vitamin D3, cholecalciferol, in the skin when exposed to ultraviolet B, UVB rays from sunlight. Spending 10 to 20 minutes outside without sunscreen, ideally between 10 a.m. and 2 p.m., can support natural vitamin D synthesis. However, factors such as skin pigmentation, geographic location, season, and air pollution can affect how much UVB your skin absorbs. Dietary sources. While fewer foods naturally contain vitamin D, certain options include fatty fish, e.g. salmon, sardines, mackerel, cod liver oil, egg yolks, fortified foods such as milk, orange juice, or plant-based alternatives. It's worth noting that dietary intake alone is often insufficient to meet optimal levels. Supplementation. If sun exposure is limited or your levels remain low despite dietary efforts, supplements can be effective. Vitamin D3, cholecalciferol, is the preferred form for supplementation. Dosage should be guided by lab results. Common maintenance doses range from 2,000 to 5,000 IU per day, but some may require more under medical supervision. The role of magnesium in vitamin D metabolism. A lesser-known but vital aspect of vitamin D optimization is ensuring adequate magnesium intake. Magnesium is required for converting vitamin D into its active form, calcitriol, allowing it to bind to its receptor and function effectively. Without enough magnesium, vitamin D remains inactive in the body. Magnesium-rich foods include spinach and leafy greens, pumpkin seeds, almonds and cashews, avocados, black beans, and legumes. For individuals with poor dietary intake, a magnesium glycinate or citrate supplement may be beneficial. long-term health benefits of maintaining optimal vitamin D. When vitamin D levels are in the optimal range, the body is better equipped to strengthen bone density and reduce fracture risk, regulate immune function, lowering the risk of infections and autoimmune disease, improve cardiovascular health by supporting normal blood pressure and vascular integrity, reduce the risk of certain cancers, particularly colorectal, breast, and prostate, enhance mood and cognitive function, particularly in seasonal affective disorder, SAD, support thyroid and metabolic balance. These effects make vitamin D not only a foundational nutrient for basic health, but a powerful tool for preventive care and longevity. Conclusion: vitamin D deficiency is more common than many realize, and often overlooked until it contributes to significant health problems. By recognizing the signs, testing levels regularly, and integrating simple lifestyle habits like sunlight exposure, strategic supplementation, and nutrient-rich foods, individuals can take proactive steps to safeguard their long-term well-being. With attention to both vitamin D and supportive nutrients like magnesium, you can optimize your health, boost your immunity, and lay the foundation for stronger bones, a brighter mood, and greater resilience.